Hi everyone, welcome to our channel. Thank you for watching, we really appreciate your patronage. Please like, share and subscribe to our channel. In our today's health edition we are going to enlighten you on ectopic pregnancy. Causes of ectopic pregnancy. Symptoms of ectopic pregnancy. Diagnosis of ectopic pregnancy. Treatment of ectopic pregnancy and prevention of ectopic pregnancy. Ectopic pregnancy is a complication of pregnancy in which the embryo attaches outside the uterus. Normally, a fertilized egg travels to the uterus to attach itself, but in an ectopic pregnancy, the fertilized egg attaches itself to the uterus. Rather, it may attach itself to several other locations outside the cavity of the uterus. Ectopic pregnancy mostly occur in the fallopian tube and are so-called tubal pregnancy. However, they can also in other places including the cervix, ovary, or abdominal cavity. An ectopic pregnancy cannot proceed normally and may eventually lead to death of the embryo. An ectopic pregnancy is a medical emergency as it can cause life-threatening bleeding if left untreated. The fallopian tube may rupture and may lead to internal bleeding, shock, even death. The following conditions have been associated with an ectopic pregnancy. Number 1. Inflammation or scarring of the fallopian tube. Number 2. Hormonal imbalance. Number 3. Genetic abnormalities. Some factors that predispose a woman to have an ectopic pregnancy may include previous ectopic pregnancy, sexually transmitted diseases such as gonorrhea, previous tubal surgery, abdominal surgery, pelvic surgery, multiple abortions, smoking, pelvic inflammatory disease, maternal age of 35 or older, reproductive technology and history of infertility. Symptoms of ectopic pregnancy are breast discomfort, vaginal bleeding in varying amount, sudden lower abdominal pain, pelvic pain or discomfort, dizziness or fatigue. Sometimes it gives no symptoms. Occasionally, the doctor can carry out a pelvic scan. This may help the doctor in identifying areas of pain, tenderness or mass in the fallopian tube or ovaries. The doctor may carry out a pregnancy test to ascertain that you are pregnant. This test is done via blood test to check the level of human chorionic gonadotropin, HCG, hormone, which usually increases during pregnancy. An abnormal pattern in the rise of this hormone can be indicative of ectopic pregnancy. A transvaginal ultrasound is carried out. This allows the doctor to see the exact location of the pregnancy. In rare cases, laparoscopy may be needed to confirm diagnosis. Treatment option depends on your symptoms and when the ectopic pregnancy is discovered. Methotrexate medication is often used to treat an early ectopic pregnancy. This medication stops the growing cell of the placenta to dissolve existing cells. This may cause abortion or the developing embryo may pass with a menstrual period. It is very important that ectopic pregnancy is confirmed before this treatment is given. However, conception may be delayed for several months after taking this medication. Surgical intervention may be required if bleeding has already occurred. Laparoscopy or laparotomy surgery is used to gain access to the pelvic. The ectopic pregnancy is either only removed, salpingostomy, or the affected fallopian tube is removed along with the pregnancy, salpingectomy. Ectopic pregnancy is typically discovered early in pregnancy. Healthcare providers usually diagnose ectopic pregnancies in the first trimester, up to 12 weeks of pregnancy. However, most people discover they have an ectopic pregnancy around 8 weeks of pregnancy. Prediction and prevention aren't possible in every case. You may be able to reduce your risk through good reproductive health maintenance. Have your partner wear a condom during sex and limit your number of sexual partners. This reduces your risk for STDs, which can cause PID, a condition that can cause inflammation in the fallopian tubes. Maintain regular visits with your doctor, including regular gynecological exams and regular STD screenings. Taking steps to improve your personal health, such as quitting smoking, is also a good preventive strategy.